Hi, I'm Cheryl Ingalls. My project is on the socioeconomic status and inequality in access to healthcare. Issues of diversity in modern culture have shaped social practices in modern culture in many ways. We can compare today's modern family to a family from the mid 20th century. At that time, the family unit would consist of a married, heterosexual, same race couple with children. Today, most of society accepts a mixed race, homosexual, married couple raising children. People with physical and developmental disabilities are able and encouraged to work and attend school in the communities. The ease of travel has contributed to the mixing of cultures and development of traditions for families. The topic of race has definitely influenced some people in modern society. We need to educate our peers as well as folks who grow up in an earlier era that still hold embedded beliefs of racial stereotypes. As we've learned in this course, all humans have the same genetic makeup. We are all equal. Race is not biologic, and we are not divided into different species, as thought in earlier times. Social change has occurred with travel security after the horrific events of 9/11/01. Security had to be increased, and along with it came racial profiling. I have an excerpt I'd like to share from an Iranian student regarding her personal experience with racial profiling. I quote, "I also seem to have this peculiar power to make people at airports and train stations visibly uncomfortable." End quote. Diversity has added a new dimension to nursing. As a nurse, assessing a patient, I need to be aware and sensitive to a patient's cultural, religious, ethnic background, sexual orientation, and identification. This is necessary to implement proper assessment, treatments, and follow-up care. We need to be aware of normal variation in skin tones when assessing for anemia and bruising on a patient, as these present differently with different skin tones. Pain and discomfort is expressed differently from culture to culture. We need to respect and include a patient's diverse religious beliefs, customs, meal preparation, and food choices into their plan of care. We may encounter physical evidence of alternative healing methods, such as cupping and coining, and beware not to accuse people of abuse unnecessarily. Modern society has changed regarding the subject of acceptance of homosexuality. Homosexuals are able to legally have a civil union or marry in a church in some states in the United States. Prior to this, homosexual couples were not allowed to marry and mostly had to live their lives in the closet. The benefits of overcoming issues of diversity would be that we would all be more tolerant of each other's and our differences. We could all learn and appreciate from each other and all of our differences. We should embrace this. Just think of how boring it would be if we're all alike. If we could overcome and be more tolerant and accepting of each other's beliefs, even in small increments, it could lead to decreased unrest and wars in regards to religious and ethnic intolerance. A lot of population have unconscious assumptions and fears about different cultures. The biggest challenge would be to convince people to break and look past stereotypes that have been ingrained throughout the years. Every person has a right to equal health care, the right to the highest attainable standard of physical and mental health. Why do disparities matter? Disparities in health and healthcare limit continued improvement in overall quality of care and population health and result in unnecessary costs. Health and healthcare disparities, they refer to differences in health and healthcare between our populations. Socioeconomic status embodies an array of resources, money, knowledge, prestige, power, and beneficial social connections that can protect health no matter what mechanisms are relevant at any time. Meaning, if you have money and any one of these resources, you are able to move out of an area that is having an endemic and have an easier access to health care. Many disparities exist, and here are some of the main factors contributing to problems with access to health care. Many people in the U.S. are unable to buy or maintain access to health care due to their social stratification, lack of income, anywhere from homelessness to the working poor families that are unable to make ends meet, lack of health insurance, their race, and their level of education. Lack of health insurance, as we know, health insurance is very expensive and people with lower income may only be able to buy a plan that limits services, medication, treatments, or providers they are allowed to see for their care. A regular source of care. Some groups of individuals are unable to see the same provider for follow-up care and rely on walk-in clinics or emergency rooms as their primary care provider. These emergency room visits cost money, and the bills start mounting for these individuals. There are legal barriers for low immigrant income groups. Medicaid is not available to immigrants until they have been citizens for 5 years. There are structural barriers which limit people with mobility difficulties access. Their lack of health care providers, and age is another reason. Non-elderly adults have a higher risk of being uninsured compared to children. It's 21% to 10%. Where a person lives affects their ability to access health insurance coverage. In Massachusetts, where I live, there's a 4% uninsured population as compared to Texas at a 24% uninsured. Access to health insurance by race. This is a study by the National Health Disparities Report, and it shows white citizens and non-Hispanic white citizens having easier access compared to Asian Indians and Alaskan Native, and also Hispanic, which have a lower available access to health care. Same study compared access to health insurance by education and income. If you have at least some college education, it's available. Health insurance will be easier for you to get. Higher income, the same thing, it's easier for you to get. And less than high school education, it's more difficult to access insurance. Without health insurance, people are more likely to delay or go without the necessary things that they need. The target population is low or no wage earner. Many have jobs with low wages, mental health issues, addiction, lost employment, physical disabilities. Their geographic location is probably affecting their ability to access health, their sexual orientation, citizenship status, and their race. And homelessness. Homelessness and healthcare are intimately interwoven. Poor health is both a cause and a result of homelessness. For example, becoming ill and losing income, as well as already being homeless and unable to access proper health care, is the example. Barriers to health care are embarrassment, lack of ID, no knowledge of where to obtain treatment, lack of transportation. Socioeconomic status and access to health care relates to socioeconomic status and diversity directly. Socioeconomic status regulates access to quality health care and knowledge of health behaviors. It is also a predictor of health. The long-term effects of adversity or stress on the body can lead to poor health. Socioeconomic status is related to multiple disease outcomes due to multiple risk factors. This is fueled by risk factors such as poor diet, inadequate exercise, and smoking, which I have a chart up here. Low socioeconomic status is related to mortality from chronic disease, communicable diseases, injuries. Health promotions such as preventative screenings are not targeted at the poor, and that is likely to increase the disparities between the socioeconomic statuses. There are numerous problems with access to health care, and many disparities exist. A number of groups are at risk of being uninsured. There are people of color and low income, as I had said before. Without health insurance, people are likely to delay or go without the necessary medication and treatments for this. They're choosing to buy their groceries or pay rent instead of taking care of their health. The healthcare system in the U.S. does need to change. We need to be prepared for the future care of our diverse population. It will take a continuous multidisciplined approach to manage this feat. Without fixing the inequities, healthcare costs will continue to rise. And it's estimated that 30% of direct medical costs for Blacks, Hispanics, and Asian Americans are excess costs due to health inequities, and the economy loses an estimated $309 billion a year. Well, the government has put a couple plans in place. The Department of Health and Human Services developed a plan to reduce racial and ethnic health disparities, the HHS Disparities Plan. This plan is built on programs as Healthy People Initiative, state, local, and private organizations. The Affordable Care Act was put into place in March 2010 to reduce disparities and improve healthcare access to vulnerable populations. My plan is I would like to fight to have stricter regulations, transparencies, and oversight on insurance companies. I would like to open more nonprofit volunteer health clinics, ensure healthcare staffing was culturally diverse to care for the population they'd be serving. I would reach the homeless population by running mobile clinics that would reach out to shelters and streets. I would involve neighborhood churches also, not only for healthcare, but to distribute healthy food and education about healthy living. I would also want mobile clinics to visit urban, low-income areas to deliver low-cost to no-cost healthcare, along with an education component to teach about healthy lifestyles. I would ensure the insurance companies are not overcharging for their services, and I'd like to start a program ensuring healthcare and job training for people at risk, low socioeconomic status, disabled, and elderly. I feel it should also begin by training when children are in school, cradle to college. Early childhood development is important and likely to influence health. This involves school readiness, which predicts later school performance. And then later on, it also predicts educational attainment and eventually predicting economical resources and employment opportunities. This plan would be to prevent people from falling through the cracks in the healthcare system. I'd contact philanthropists for nonprofit healthcare facilities, run fundraisers. I'd form committees to perform oversight. And activate the community to become involved in the process of changing policies instead of complaining and blaming the government. At last, my plan would bridge a gap in accessibility to healthcare by ensuring healthcare services are more readily available to the target population. Diverse ethnic groups seeking medical attention will trust providers that are culturally diverse. People will be educated on signs of ill health and learn when to seek medical attention before their conditions worsen. Disparities will be resolved, costs decrease, and it will ensure equal access to healthcare to all. Thank you.